A very good afternoon to you all. It's great to be here, and thank you very much for joining us. My name's Hamish Laing, and I'm the Director of the Value-Based Health and Care Academy. If I could have my first slide, Larry. Thank you very much. I've been asked to talk to you about the Value-Based Health and Care Academy in Wales, and really to tell you what it does. So the Academy is part of a Welsh Government programme of intensive learning academies. And the intensive learning academies were recommended in the Parliamentary Review into Health and Social Care, and they feature in A Healthier Wales, the long-term plan for health and social care in Wales, which was the plan for the last Welsh Government and has been kind of re-adopted for the current government term. And in A Healthier Wales, it says many things about the academies, but it sets out really what their purpose is, which is to enable Wales to retain and develop engaged and ambitious health and social care leaders that are adept in the knowledge and science of innovative practice needed to deliver the vision which is set out for 2028 in A Healthier Wales. And there were three academies initially developed, and there is now a fourth. There is the Value-Based Health and Care Academy, which is what I'm going to talk about this afternoon. There is the All Wales Academy for Innovation in Health and Social Care, which is run by other colleagues of mine in Swansea University in partnership with Cardiff and Cardiff Uni. And then there is the ALF Academy, which is run out of Bangor University and focuses on prevention and behavioural change. And now just recently a fourth academy is being developed around digital transformation, but with the University of South Wales. So that's where the academies come from. And as I say, Value-Based Health and Care is one of them. And I'm very proud to be its director. Next slide, thank you, Larry. Who is the Value-Based Health and Care Academy for? Well, we are really targeting colleagues from four areas: from health, from social care, from the third sector, but also from the life science industry sector. So that's medtech and pharma and diagnostics and so on. And broadly, we're looking for leaders and aspiring leaders in those areas. Now, Welsh Government have part funded the academies, and their funding, of course, is directed to NHS Wales and social care in Wales and the third sector in Wales and so on. But we as a university, and indeed Welsh Government, are very keen that the academies are, have a global impact and global interest. And we achieve that in our academy by having faculty to teach from around the world and also learners from around the world. And we've already taught in something like people from something like 45 countries on our education programs. So it's definitely not just inwardly focused on Wales, but clearly Welsh Government funding is there to support Welsh learners. Next slide, please. So our academy, like the others, is built on three pillars. There is a pillar around education, and I'm going to talk quite a lot about that in the next few minutes. A pillar of research and a pillar of consultancy. And all three of those underpin the academy. And in fact, there's a very important both overlap and dependency between them all. So, for example, we want our education programs to be teaching the latest knowledge acquired through research, but also for our research to be advancing knowledge in these areas. Consultancy is important about helping people to translate learning into practice in a more sustained way. We think our courses are excellent, but just doing a course is sometimes not enough to make your whole organisation value-based. So we're very keen to work with organisations to help them actually put it into practice over a longer period of time. But also the consultancy is there to help underpin the financial viability of the academy as well. Next slide, thanks. So just starting with education, we have a really quite a wide-ranging educational offer from the academy. I'm probably starting at the kind of most senior. We have a DBA, a Doctorate of Business Administration, It's a bit like a PhD. I'll talk about these in a bit more detail in a moment. We have a brand new MSc that's been developed, purpose-built for learners such as those that we are aiming at. It's not an old degree, it's a brand new degree, and it's structured for delivery to professional learners, people who are working. We have intensive education programs, so these are short course, maybe 2 days of intensive learning to teach people the principles of value-based healthcare and how they might start to think about developing strategies and putting it into practice. We will have, from January next year, a foundation program, which is an online e-learning program, self-directed learning, a little bit like the sort of learning you might do for mandatory training, for example. And that will be a really useful introduction to value-based healthcare. We've got some bespoke educational programs, so we've developed programs with specific audiences and target and clients in mind, and we've already run those. For example, for one of the health boards in Wales, we've co-created a program for them that we help deliver for their operational managers and frontline clinicians, but we've also done work with some of the big life science companies as well. We have a masterclass series, and we started that last month with our first masterclass, and we're looking to run those probably twice a year. And then a quarterly e-bulletin, so that's a combination of kind of news and events, but also some of the latest thinking in value-based healthcare, and we're sending that out not only to all the alumni of our courses, but anyone who chooses to sign up to it on our website. So if you are interested in that, please do log in and do so. And we're really delighted that our MSc and our executive education programs have just met the requirements for accreditation by the Faculty of Medical Leadership and Management, one of the bodies that accredits for CPD. Next slide. So just to say a little bit more about each of those educational programs. So the DBA, as I say, that's a little bit like a PhD. It's a doctorate level degree. My colleague Simon Brooks is the program director, and this is a taught research degree. Next slide, thank you. So it's built very much around a research thesis in the same way that a PhD would be, but instead of it being that's all it is, and you to some extent are kind of left on your own a bit in a PhD. Here you take your research proposal, you're helped to develop it. The taught elements are about how best to conduct research, the principles of research, how to analyze data and collect it, and so on. Throughout that time, you're doing the research itself, and you will deliver a thesis which is tested at a viva at the end in the same way that a PhD is, but it's perhaps a little bit shorter than a PhD thesis, with this this part-time 4-year program running alongside it as well. And that has proved to be honest, much more popular than I was expecting, which is really great. So we've got 6 students who've just started this month on our DBA program for the first time. Next slide, thank you. We then have the MSc, and as I say, the MSc has been developed specifically with the academies in mind. And I say academies because actually this MSc has been developed jointly between the Value-Based Health and Care Academy and the Innovation Academy. And it's a single MSc, a single degree, but it has 2 pathways within it, which I'll explain in a moment. Program director for the overarching MSc is my colleague Rob Thomas. Next slide, thank you. So this is a schematic of how the MSc works, and you'll see that the different colours mean different things. So the dark blue modules are modules that are taken jointly between the 2 pathways. So whether you're on the innovation pathway or the value-based health and care pathway, you do that, you learn together with the students. And we think that's really important because there's clearly a lot of innovation associated with value-based healthcare, and we think that value-based healthcare should underpin innovation. So this is the schematic for the course being taken part-time over 2 years. This is designed very much around the working professional, You can do it as a full-time one-year course if you want as well, and we'll be running the full-time course starting next September. But this year we've started with the part-time, which I think, as we expected, was the more popular option. So the first 4 modules are drawn, in fact, from the MBA in the School of Management in Swansea. And these are done, as I say, across the 2 pathways. The 5th module, Prudent Health and Care Policy and Practice, again is a joint module, and that's deliberately to set value-based healthcare in the context of prudent healthcare in Wales and the other global equivalents, choosing wisely, parsimonious healthcare, the slow medicine movement, and so on, but also to set it in the context of social care policy. And some of you may know that in social care in Wales, in fact, the Social Care Act in Wales talks a lot about person-centred care and outcome-focused care, the fundamental principles of value-based health care. And actually, the reason why we call our academy and our programme Value-Based Health and Care is to reflect that it is entirely aimed at colleagues in health, but also social care and the third sector as well. And you'll see the modules in orange with the dotted line around them. Those are the 3 specialist modules for people on the value-based health and care pathway of this MSc, and they focus on the principles of value-based health and care, the development of a strategy, and then moving on to how do you implement it in practice, how do you create the culture and the leadership, some of the more detailed elements of costing and measurement, and how you're going to put that in practice in your own organisation. Throughout this second third of the degree, the middle third, there's also a module about research in a health and care context, and this is really teaching you how to conduct what will be the third of the degree, the last third, which is a workplace-based project. And we think that's a really important element of it. Firstly, because it will help you to put into practice the learning, but secondly, to give something back to your employer who's released you to do this degree. So that's the MSc. The next slide, please. And this is just a typical one of the typical modules. So roughly how it works. There's the 3 or 4 weeks at the beginning of kind of leading up to a workshop in the middle, and a typical structure would be the face-to-face teaching. It will be conducted on a Friday with a lecture. There will be seminars, and there'll be a lot of online learning which can be done in your own time. So pre-recorded lectures, other materials, and so on, and reading to do. So a lot of it is done in your own time, but some structured face-to-face teaching which will be on a Friday in the university. And then once every module, so that'll be a total of 8 over the 2 years, there's a Saturday workshop where you'll come to campus and spend the day, and we'll really get into the depths of the learning and opportunities for you to present and discuss and so on. And then there are other elements of assessment, of course, because it's a degree, that are taken towards the end of the 10 weeks. Next slide, thank you. So that's a brief overview of the MSc. The intensive executive education or short course education programs we have been running for a while now. They've been very popular. We'll have had a couple of hundred people through them, the varying forms of them in the first year. And they are directed by me. The next slide, thank you. So these can be taken either as a 2-day face-to-face course, which is how we originally envisaged it prior to COVID, or because of COVID, we had to move it into an online delivery, and it's online. It's 7 2-hour sessions taken online, but synchronous, so in other words, in real time. And actually, that's been such a success of being able to have a global audience by doing it online. Although we are moving back to doing face-to-face, we are going to keep once a year, we're going to run it online deliberately, as it were, in order to be able to attract students from around the world. And a typical programme starts with talking about value-based healthcare theory, We always start with a patient voice, and that's really powerful. We have some excellent patients who contribute to our programs, and talking a little bit about what are the learning goals people want to get out of the course. We then move on to the principles of measurement and the use of outcomes and how you organise yourself around value, based around case-based learning, so drawing from structured cases to read in advance and to learn from. We then talk about creating the culture you need for value-based healthcare and system working and implementation of the principles. We talk about the relationship between health and care and third sector systems and the life science industry, and the opportunity of creating partnerships. We test some of that work of partnering with industry, but of course that same learning applies of how you might procure a third sector partner, for example, from social care or from health. We then talk about how would you put that strategy, develop your own strategy and put it into practice, and then reflecting on the course as well. So that's our typical 7 modules, or as I say, delivered as 2 days face-to-face. Next slide, thank you. So scholarships, this is an important part. Because we are part funded by Welsh Government, we are able to offer some very generous scholarships for our programmes, and these are called in Welsh Government Intensive Learning Scholarships. Next slide, thanks. And so they are available, because they're funded by Welsh Government, they're only available to learners working in the NHS, social care or the third sector in Wales. They're available for just about all of our education offers. So they're available for the MSc, either full-time or part-time. They're available for the DBA, all 4 years of it, and for the short course programs. And they meet 100% of the tuition fees, whether you're doing a short course or the full 4-year DBA. So they're very generous, and we have quite a lot of them. I'm delighted to say we are obliged to, and we're very keen to spend all the money. So that we're very keen to award the scholarships, and therefore very keen that people apply for them. The process of applying is all set out on our website, but essentially you apply at the same time as you apply for the course you want to do. It's a separate process, but you do it at the same time. Clearly, we only award scholarships to people who are who are accepted onto the programme they're doing. And the details of how you do it are on our website. Probably the key message is that if you're thinking of doing our next executive education short course, which is in March, the closing date for scholarships and therefore for applying for the course itself is the 31st of December. That's the last possible date. Of course, you can apply from now on. And the critical thing for the DBA, these are the criteria are around academic qualifications. But for our MSc and our short course education, the criteria are really about whether we think you're likely to put into practice the learning. That's the purpose of the Welsh Government funding, is to make the system change to be more value-based. And so it requires a personal statement from you about how you would use the learning, and from your line manager. And we know that it can sometimes take a little while to get those statements sorted out, so please do start early so that you can get your application in time. Next slide. The foundation course is still to come, but we're actually actively working on it now. It's making very good progress, in fact, and that's going to be free to everybody. It's going to be freely available. It's going to be run on a platform that we use in the university called Canvas, but you'll be able to just register from your home address, home email or work email as you wish, and do the course. It's going to be 3 modules that will build up to give you all the sort of principles of value-based healthcare as an introduction to it. We hope that might inspire you to want to do some of our other courses, but if nothing else, it will give you, I think, the framework, and you'll understand what colleagues are talking about when they talk about value-based healthcare, in much the same way that IQT Bronze was intended to do the same for quality improvement. And as I say, that'll be going live we think in the middle of January next year. So we're very excited by that. And it's got 3 modules. You can do it in your own time. You can do it from home or at work. It'll have multimedia type delivery. There'll be a test of knowledge, a little bit like you sometimes do in mandatory training. If you pass the test, and you'll be able to redo it if you don't, and you get all 3, you'll be able to get a certificate of completion, which you can use for your PDR, CPD portfolio. Next slide, thank you. Bespoke education, really just to say that we're very happy to work with organisations to develop education programmes. As I said, we have done so for Swansea University Health Board, and we're about to run a, well, in fact we're going to do it next week, but the First Minister has intervened because of COVID, but we're looking to run a programme probably now in the new year with Powys, Betsy, and again Halvar as well. So we're happy to do that, but we've also just run a global programme for the chief executives of one of the very big life science companies as well. Next slide. The masterclass series, just to say that we're planning to run those twice a year. It was run online. It was very successful. We had Sally Lewis from Wales and Gerard Klopp, who's from Holland, talking about how value-based healthcare can be applied for older persons' care, and this idea of value-managed healthcare, which Gerard has written about. And that was a really interesting session, and we'll be publicising those, I hope, through the value-based healthcare website in Wales, but certainly our own and through our newsletter. Next slide, thanks. So that was the first, so priorities for value-based COVID-19 recovery for older people. Next, thank you. And then our e-bulletin is a chance to keep up to date with what we're offering, to get the latest dates for closing dates for our courses. And as I say, they're often built around a blog about some interesting aspect of value-based healthcare. This is an example of the last one. The next one comes out on the first week of December. And you can, through our website, sign up to receive the e-bulletin. So because of GDPR, we can't sign you up in other ways. So please do sign yourselves up. And I hope very much you'll find it interesting. And please do tell us about interesting things you're doing about value-based healthcare, and we can look to include them in our bulletin as well. Next slide, thank you. So that's education. I just wanted to briefly cover research and consultancy. We do a lot of research. Value-based healthcare is a new paradigm, or relatively new paradigm, and there is an awful lot to learn about how to do it in practice and how to make it work. Almost every aspect of it warrants further understanding and research. So we have a program mostly funded by industry, specifically by Pfizer Inc., the global Pfizer business, who are looking to make their business more value-based and indeed to be rewarded, paid for, their medicines paid for on the basis of the outcomes they create rather than the number of tablets you buy, which is how most medicines are sold now. And so we've done a number of different things with them. We've looked at, we've done research to look at the skills required in the workforce, both in the health system and in industry, if people are going to work in a value-based way and work together. We have an interesting project called Ideate that's running, that's actually led by DHCW, NWIS as was, with another partner called LCP, really looking to how you develop outcome-based agreements. So payment for medicines on the basis of outcomes using real-world data and modelling in Wales. And that's got to a really exciting stage now. We did a big study with colleagues in SAIL, which I led, looking at creating the ICHOM outcome data set using routinely collected data. One of the challenges of outcomes is you've got to sometimes put in a lot of processes to capture outcomes. And we wanted to see if we could build the ICHOM outcome data set using the data that's already around in NHS Wales and PROMs, and bringing them together. And we've just submitted a manuscript that said we thought you could just about do that. Evaluation of the value of patient-held records. So we're doing work with Halvar, which is led by Halvar, which we're supporting, looking at whether a patient-held record adds value alongside medicines in the care of a chronic condition such as persistent pain. And we've done some very interesting research looking at societal impact, or one element of societal impact, which is the impact on people's productivity and work. Again, actually with chronic pain as a model for a chronic condition, working with Rolls-Royce Engineering and their workforce data. Next slide, thank you. But we've also done some research funded by, not by industry, so by Innovate UK and the NHS. We're looking at a study which is just about to start recruiting. I think it cleared ethics last week, so we're hopefully going to get the final paperwork in place this week, which is to look at family reported outcomes. So what's the impact on a family member of having a disease, and therefore what's the value to the family of treating that person's disease. And we're going to do that in these very high cost patients being considered for very high cost gene therapy treatment, ATNP treatment. You may know that there's a gene therapy just been approved by NICE that's the list price is £1.89 million per person. So these are very high cost, and it's really important to understand the wider impact beyond just the person into society of those sort of treatments. And we're also looking at how would you collect family reported outcomes in a routine practice, not in a research setting, and there's a whole set of complexity around that and information governance and so on. Just a quick advert. We're recruiting staff to the academy, I'm delighted to say, and we've got a senior lecturer post that's actually open at this very moment. So if you're interested in doing research in value-based health and care, please do look at our that link and think of applying. And we'll have another postdoc to be advertised very shortly. Next slide. And then finally, consultancy. As I say, we think our courses are good, but we recognise that doing a 2-day course isn't perhaps enough to make your entire global organisation value-based. So we're really keen to work with health systems, with social care, with third sector organisations and with industry to help them to translate the principles and learning actually into practice. And we have a number of consultancy projects running. We have a big one with global pharma company and also a company in the UK. We're just entering into a consultancy agreement with a big global medtech company, and we're also working with some diagnostic companies as well, but also with colleagues across NHS Wales and NHS England. The integrated care system in England, a lot of those are being set up around a value-based principle, and they've turned to Wales to the national programme, the Value and Health Centre, and ourselves in the academy to help them in various ways with that, including education. And we're also working with Health Education England to incorporate the principles into their new generalist elements of the training programme for doctors, and then hopefully more widely. The CMO's office in Scotland are talking to us as well and have been taking part in some of our educational offer. And internationally, we're talking to some other health systems as well, currently in Holland, for example. So lots going on, and it's really exciting to see Wales really kind of making its mark in the world on this. But we recognise also there's an awful lot of learning to come the other way too. So it's great. We're part of a number of European organisations, including the EU Alliance for Value and Health, where we are affiliated, or to which we are affiliated. And that's helping us to get learning from colleagues around the world in what is an emerging global movement, I think, for value-based health and care. So I think that's my last slide. Yes, here's the last slide. That's my email address. That's our website. And if you're clever and it works, you can scan that QR code and it will take you to our website, or it'll take you somewhere interesting. I hope it'll take you to our website. It would be great to hear from you. Happy to answer questions now, of course, but also do drop me an email. But please do look at our website and our brochure. It gives you a bit more information than I've been able to cover this afternoon. And I really hope we will see a number of you on our various courses over the next year or so. So with that, I'd be very happy to answer any questions. Thank you very much. There are some questions coming in, so let me just pick them out of the chat. So, are the courses available to those without formal qualification if you have enough relevant experience? Yes, is the answer to that. And we recognise that a number of colleagues in health, social care, and the third sector may not have a lot of academic qualifications, but have a lot of relevant experience, and so the entry criteria allow for that. There is a need to, an element of checking for that, particularly for the DBA and the MSc, less so for the executive education programme. But relevant experience is part of an option for criteria, one of the criteria. The e-learning modules that I mentioned, will they be freely available via ESR for NHS Wales staff or delivered via another platform? You may be delighted to know that they won't be delivered via ESR. unless ESR's got a lot better than when I was in the NHS, because I can never find anything on ESR. No, it's going to be delivered on a university platform which is called Canvas, which is one of the two big global so-called virtual learning environments, e-learning platforms that universities and schools use. And there is a part of Canvas called Canvas Catalog, which in fact the university has just procured for this very purpose, which, if you like, is a kind of shop front to Canvas, and it means that you can get access to modules in Canvas in the university without having to be a registered university student, which up until now has been a problem. So you'll be able to just find the course. We'll obviously promote and publicise it when it's available, and hopefully with colleagues in the Value and Health Centre will help with that too. And you'll then be able to just register with a few basic information, your email, your name, and one or two things that we need to collect to keep Welsh Government happy. And then you'll just be able to access the courses in your own time there. So it won't be on ESR, but it should be straightforward. If someone wishes to self-fund attendance at any of the courses, is this possible? Yes, it's very welcome. We're at universities, so we're always pleased when people want to self-fund. And of course, we can't give scholarships to everyone. And over time, the academies have to become independent of Welsh Government funding. So yes, it is possible to self-fund. The short courses are £1,500. The MSc, I can't remember. I think it's 11,000, something like that. It's on the website, and you can self-fund, or of course you may be able to get some support from your employer, perhaps partial funding from that as well. And we're very happy to do that. Some health boards have block booked some places on our executive education programs, and we're happy to talk about that as well. And people who want to book lots of places can have a discount. Are there plans to include value-based healthcare teaching as part of the graduate medical or health care allied professions in Wales? Is this in a similar way to the way QI is now part of the curriculum? That's a great question. For health systems to become truly value-based, every bit of it has to be value-based. So it needs to be value-based in terms of what we would call episodic care. So, something like a knee replacement. Are we getting best value from that? It needs to be value-based around the whole pathway of care, starting at prevention, going right through and including social care and third sector contributions. And actually, although I can't evidence this, I suspect we will find that some of the very highest value care is delivered by colleagues in the third sector and social care. And it therefore needs everybody to understand it. And procurement of goods, procurement of services, procurement of medicines, they all need to be value-based, as do some of the decision-making around some of the regulatory decisions like NICE and so on. So we need everyone to understand it. And therefore, we definitely need to be teaching people, the clinicians of the future, but also the social care practitioners of the future. In Swansea University, the graduate entry medical school, they do have some teaching, in fact, from Sally Lewis at the moment on value-based healthcare, but we would love to expand that, and there are conversations going on with the medical schools about that. But it definitely shouldn't just be the medics, and it should be all our colleagues in nursing and social care and health science and so on. So there are plans, and they're in various degrees of development. New School of Pharmacy just launched this week in Swansea, or this month in Swansea, and we're talking to colleagues there, of course, as well, from the medicines perspective. Value-based health is a big change in the way care is traditionally delivered, and we need to bring our communities with us. Are there any resources available for communities or patients to help educate them on the skills they will need to fully embrace value-based healthcare? For example, digital skills, health literacy, data literacy, etc. That's another great question, actually. And I feel very strongly, as we do in the academy, that patients and service users, in the broadest sense, they need to know that actually, value-based healthcare is about what matters most to them. And they need to know that, and they need to be expecting the health system to be wanting to find out what matters most to them through co-production, collection of patient-reported outcome measures, and other ways. And just the whole culture has to be about what matters most to them. And so they could be a very powerful driver for change, accelerating the adoption of value-based health and care across the health systems and care systems. So I think it's a really good question. As I say, in all our courses, we start with a patient talking about their experience, and we have content that relates from social care as well. Colleagues in Social Care Wales have given us fantastic videos of their clients talking about what matters most to them. We in the Academy do not yet have a programme to, if you like, educate patients in value-based health and care. And I know in the national programme in the Value and Health Centre there is thought about that. But the more we can do that, the better. So we're very keen to partner with colleagues if that would be helpful to try and develop some programs. Of course, our online learning modules would be available to anybody. And so there is no reason why members of the public, as it were, couldn't take part in those as well. But it's really important. On the digital skills thing, just to declare an interest, I'm the chair of the Digital Inclusion Alliance for Wales. I feel very strongly about digital inclusion and how we support people. There are some great programmes, fantastic work going on in communities all across Wales and more widely. Welsh Government fund Digital Communities Wales, which is a digital skills programme for Wales, and the Good Things Foundation and other colleagues across England, and also the colleagues in Scotland to do something similar, because it isn't essential to do value-based healthcare to have digital skills, but it is helpful. And we feel very strongly in the Digital Inclusion Alliance that whilst it's really important there is always an alternative for people who are not online or don't want to be online, and of course health systems attract a higher proportion of those people than the general population, because it's much more likely that you'll be digitally excluded if you're elderly, big users of the NHS, or if you have long-term conditions, if you're poor. These are another big group of big users of the NHS. So it is a problem. So it's important to offer an alternative, but we think it's even more important to support people who want to be online, to be able to get online, to get all the benefits of being online. So there is stuff separately going on around digital skills, but probably not, and there is stuff about co-production more generally, but probably not yet. We aren't yet using the general public to focus on value-based healthcare, and we probably should. I think that would be good. I'm just quickly scrolling through these to see if there are any more. I think I have answered those questions. Are there any other questions, colleagues, that people would like to ask? No, that's good. So in which case, let me just thank you very much indeed for your attention, and also to say that there is, as I say, we have an e-brochure on our website, and we have a lot of information on our website. We also have an email address if you want to just email us and ask us about this. Please do leave here today and tell your colleagues about it. We obviously want all the academies to be a success, so do tell them about the others too. And Welsh Government have invested a great deal into the 4 academies. I mean, really substantial sums of money. And that is for people in health and social care and the third sector to get the benefit, and to develop the knowledge and skills around, in this case, value-based health and care. So we're really keen to get the word out. It's very hard to get the word out through big organisations like the NHS and social care. So please help us with that. There is information on our website. There is also some information on the Life Science Hub website about all the academies if you're interested in any of the others, because they're great too. But other than that, please do let us know, and say very much hope you will take up the opportunity to do some of our courses. If you're interested in research, you've got research ideas, tell us about those too, and do sign up to our bulletin and you'll get the latest news as well. But other than that, thank you very much indeed for your time.